it's Dr. Shirazi, aka Dr. Ozzy. I'm a board certified dermatologist practicing in San Diego, and today I want to talk about how fillers can actually make your under eyes worse. They can worsen your dark circles. As many of you know, I patented a technique called EyeGlow, which I will also talk about, but I see a lot of patients that come into my office that have had under eye fillers and now they feel like their under eyes are darker. So we'll talk about dark circles and how this can actually happen. But before we get started, don't forget to rate, review, and subscribe, and comment below. Let me know what you're interested in hearing from me, and turn on your notifications so you know when I upload a new video. So let's start off talking about dark circles. Why do we have them? They can be a lot of different causes. They could be due to pigmentation, it could be ethnicity, it could be veins around the eyes, it could be hemosiderin, like if you ever get bruising around the eyes, it can drop iron deposits that cause dark circles. It can also be allergies, just rubbing, friction, watering, tearing eyes can lead to dark circles. But today I want to focus on hollowness as a cause of dark circles, because as we age, or sometimes just genetically, I've seen really young patients with just genetically natural hollowness under the eyes that casts a shadow, and therefore it looks like that person is tired or has really bad dark circles, and it's because of volume loss. So a quick test to look for this is when you're sitting up and you look at your under eyes. If they appear dark, I want you to lie back, lie down flat, and look closely at the skin. If you still see darkening and it's in the skin, so there's pigmentation there, then your dark circles are not from hollowness, they're actually from pigment. So it's actually the skin that has discoloration, which gives you the dark circles. And you know, every day in my office, I see patients that come in, they want to do fillers, they want to do EyeGlow because they think that having a filler is going to correct their dark circles. But this is really far from reality. First of all, I want to say, can we normalize normal? What's normal is having a demarcation between the eyelid skin and the cheeks. Our cheeks are really not designed to run all the way up to the eyelid. Even if you look at little kids, they have a hollowness or a tear trough. We need to normalize tear troughs, okay? Because they are supposed to be there. And even in babies and little kids, you see that demarcation that separates the eyelid skin from the cheek. And that is normal. When somebody comes in and they're really filled all the way up to the eyelid with filler, it looks unusual and it looks unnatural. And if you see this on a video of somebody, then it may just be good lighting or makeup tricks or a filter, because our face structure is not designed like that. And so we need to normalize what is normal, and that is having a little bit of a demarcation between these two important cosmetic units. And in my office, I see a lot of patients that they come for EyeGlow, and you know, I turn them away because they're not good candidates. They don't have hollowness. Like I see these beautiful girls, they come in, they've got these long, dense lashes, and they're, you know, complaining of dark circles, and I'm like, honey, no, you don't have dark circles. What you have is a shadowing effect. When you're sitting in my office and you've got these beautiful long lashes and the light's hitting you from up top, you cast a shadow, and that's really what your dark circles are from. You have no hollowness, and so filler is not a good option for you. Or sometimes it could be somebody's eyes are deep set. That type of bone structure, facial structure will naturally, in certain lighting, will cause that shadowing effect, and fillers may not really make it better. If anything, sometimes bringing the cheek out or the under eye out can actually make that type of dark circle worse. Okay, let's talk about fillers that are used around the eyes. These are hyaluronic acid, which are found in our own skin. They're this kind of squishy, hydrating gel that help lift the under eyes and add volume, and they are clear. And so when you place a clear gel under the skin, because the eyelid skin is so thin, and you can have light pass through the eyelid skin, and the clear gel will scatter light that is blue. This is the same reason why the sky is blue. It's called the Tyndall effect. And that's because when on a clear day, light scatters, and the light that scatters is blue, and that's why it appears that way. And so I had this beautiful young girl that I saw. Here's her picture. She went in because she felt like she had dark circles, went in for filler. They injected the filler under her eyes, and she realized that her dark circles were still there, and she had this kind of blue-gray discoloration under the eye. So she went back, and she had multiple filler sessions with, not only did she not seeing improvement in her under eye dark circles, but she was actually seeing them become worse. And so I saw this beautiful girl in my office, and what was happening is this Tyndall effect. Is the filler is clear, it scatters light, and almost gives you a worsened appearance of the dark circle. So beware of this. If you don't have hollowness and you get filler, you're only putting yourself at risk of getting this blue-gray discoloration, that the only relief for this is dissolving the filler. And a lot of times you dissolve it and the patient looks better. And you can tell here in this photograph, where this is after our dissolving session, you can see her under eyes actually look brighter. They don't have that gray discoloration, and they look natural and normal. And she did have a little bit of hollowness, so she did come back, and we did do the EyeGlow procedure. So what is an EyeGlow procedure? It's not really a filler for the tear troughs. And so I want to make that distinction. EyeGlow is a technique I patented that uses a white opaque filler, meaning you cannot see through it, so it will not scatter light. And it's white, so it will help, kind of like how concealer helps lighten and brighten the under eyes. The EyeGlow filler is white and therefore helps with brightening the under eye appearance. But it's more than just a volumizing filler. It's designed, this technique is designed to lift and support really important ligaments around the eyes. These are the structures that help lift the under eye soft tissue, the fat muscle, such as the zygomatic cutaneous ligament, as well as the lateral orbicularis ligament. These ligaments need support and structure because with age they lose that, and so by adding support and structure with the EyeGlow procedure, you see this nice lifting, and then the white helps brighten the under eyes. And so a little bit about tear troughs. Tear trough ligament is actually tied down to the bone, and it is really difficult to lift that up. And there are reported cases where people try to get under the ligament and lift it up, but they actually end up getting filler, hyaluronic acid filler, into the globe, which is in the back of the eye. And patients have this persistent swelling around their eyes. And really, it's very difficult once the filler gets under the eye globe. To dissolve that filler can be a huge undertaking. So I would really caution you on who is injecting your under eyes, because it's much more complex than going in and placing a little bit of filler in the tear trough and making the dark circles go away. That doesn't happen all the time. So be really, really cautious, and it's important to know what type of filler to use and not use. You never want to use Juvederm anywhere around the eyes. Don't use it in the temples. Don't use it anywhere in the cheek or around the under eyes. It is so hydrophilic. It attracts tremendous amount of water and causes this doughy, puffy look to the eyes, and it is not the right filler, and it just gets worse and worse with time. So avoid Juvederm. Really, I find Restylane to be the safest filler to use around the eyes. EyeGlow is something that is unique to my office, and it's something that I blend and use to help brighten the under eyes, but it is only exclusive to my practice. And the last thing I want to say about fillers causing worsening of your dark circles is if you get any bruising, which a lot of times when there is a needle that's placed in the eyelid skin, because the eyelid skin is so vascularized and so thin, there's a good chance that you can get bruising. And once you get blood in the skin there, then blood has iron, and the iron deposits in the skin and causes this red-brown discoloration. So hemosiderin can worsen your dark circles. So another reason to be really, really cautious of who's injecting your under eyes. So I hope that was helpful and it gave you some insight as to how complex the under eye area is, and be cautious with under eye treatments and under eye fillers. So thanks for tuning in, and don't forget to rate, review, and subscribe. And if you're on social media, you can find me on Instagram at Skin by Dr. Ozzy, as well as TikTok at Skin by Dr. Ozzy, and check out my podcast, More Than a Pretty Face. Until next time, leave me a comment. Let me know what you want to hear about next.